Thank you, all participants in Hindi session and Sahani sir. Good evening, good afternoon, and good morning. This is the 1511th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Paul Joseph from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of well-wishers of homeopathy, homeopathic students and lovers, as well as homeopathic doctors. And we have 3 sessions every day. The first session of the day was a brilliant one tonight, and we have a very good session just finished, and that commence from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and from 9:30 to 10:30 we have a local language session in Malayalam. All these sessions are going in a good way, and we are uploading almost every videos on the very next day itself, and those who miss the session can watch again and again, and you can subscribe it without paying a penny. That's the beauty of our forum. And the purpose of the forum is to make homeopathy, to reach homeopathy every home around the world, and to promote homeopathy in that way also. So let us come to today's program. As you all know, today our guest is Dr. Professor Paul Joseph from Canada. He has completed his BHMS and R.Hom from Canada, and PG Diploma in Acupuncture, practicing Toronto, and was the former professor homeopathic medical colleges under Tamil Nadu Dr. MGR Medical University, India, and he was an author and writer of various medical articles published in Tamil books and on different subjects, and particularly on health and Kavita. He has written a lot of poems also. He was a radio host doing talk shows on health and politics in Gitanjali for the last 15 years, and doing a talk show on health in TED TV in 10 years in Canada. So that he always come up with a different, entirely different subject. And today the subject is key of compassionate care. That's an interesting subject. Let us see what Professor Paul Joseph can want to say to us. Welcome, Doctor.
Vanakkam, everyone. Good morning and good afternoon, whoever, wherever. This morning session is conducted by Professor Dr. S.M. Singh. The problem is because I can't able to understand the language, Hindi. But then here, I known to him, Dr. S.M. Singh, since 1988. So when I joined as a student in in Vinayaka Missions Homeopathy Medical College, Salem, so he used to come over there as a inspector, right, to inspect the college. From that day onwards, I known to him. Then after completion of my BHMS, then I joined as a lecturer in the same college. And at the same time also, he used to come over there as an examiner, as well as the inspector from CCH. Then after that, I joined MD Materia Medica program in Sainath Homeopathy College in Allahabad when he was a principal over there. So I completed my 2 years MD. So unfortunately, I couldn't able to attend the exam. So that's why I discontinued the program and I moved to Canada. Still, I remember Dr. S.M. Singh. He's a very great personality, very senior homeopath in India. He is a great personality. Why I am telling? Because we are whenever he comes as a inspector to the various colleges, very straightforward person. I think he is the one who has granted or given the permission to start various homeopathic medical college throughout the India. So that's why the homeopathy now is being popular and very high standard in India and all over the world. The students are practicing. So thank you, Dr. S.M. Singh. So today, I congratulate all the organizers of IFPH, International Forum for Promotion of Homeopathy. The organizers all are here. Today's topic is Queen of Compassionate Care. If anyone can tell you the remedy, which remedy I am going to talk about, if someone, you can unmute, and if it is possible, or you can put it in the chat. Okay. I think someone, which remedy, I don't know. Okay. Right. Now we'll come to the, first we are going to discuss about the case, and then I will explain about what remedy belongs to. So when I explain the case, then you can understand what the remedies belongs to that. A patient came to me, it's about some month ago, maybe around 2 months, a couple of months ago. She diagnosed her as in the case of vertigo, the giddiness and vertigo. The family physician, they diagnosed this and treated for a few months, but patient it couldn't able to feel better. So that's why someone they recommend to me, and the patient came to me, and I study the complete case. Vertigo associated with the low back pain, and the pain radiating in the both leg, especially more in the right side, as a sciatic problem, and also the patient has very severe stiffness and pain in the neck too. That's also radiating to the both upper extremities. The pain she felt more in the right scapular region. So these are all the regular the complaints of the patients. The weakness of both leg also, and numbness and stiffness in the both lower extremities. Then I ask a lot of questions and regular our case taking. Then the patient started telling about her complaint. I took the full history. It's about more than hour or hour and a half. And she has 3 kids, 3 children. All of them, they well settled and having, and he said her husband and herself, they are at home, because all the 3 kids, they left at home to somewhere to settle in a different house, and they are in different cities. The problem is, all of them, they got married within the year, but they married in a different community. Actually, she is basically a Tamil lady, from Tamil community. But the kids, all the 3 kids, they married white guys, white people, right? So from there, the problem starts. And he said, I was expected and confident, at least one of them, they got married from our community, but it wouldn't happen. So she said, I always feel that and worried about that. She said, I took care of the kids, all the kids, very, very good in nature, even from the childhood. He feed them and take care of them and clothing, educations and health, everything she did for them. So that's why I'm much worried. So she started a little weeping and not crying, little weeping and telling all the complaints. But their lifestyle have been changed and upside down from our Tamil community, and they are all now they turn into their Western culture, and they belongs to the white culture, right? So that may affect their health. And she started weeping, and because of that, she can't sleep. So she is little worried about the care, the health of the kids, because they completely changed the lifestyle from our culture to the Western culture. So a few months later, she started the complaint, the vertigo and giddiness and all these problems. At the same time, she said, I am worried about my husband, because husband and herself, they are living in the apartment, right? So she said, if anything happened to me, so what about my husband? She is worried about the husband, especially in health concern. So who is going to take care of her? Sorry, who is going to take care of him? And if anything happened to me, so what's going to happen? So that kind of the worries she has. The husband says, husband also is nearby. Just when I consult her, she is beside the patient. Then husband says, yes, doctor, this is her problem. Always worried, and still she is think that she is responsible for the kids, responsible for the children. But she has nothing to do with that. That's why she become unhappy. As a result, the problem starts. The vertigo starts, and now she is suffering a lot. Even though she is suffering a lot with the headache, with the vertigo, and she cooked for them and asked them to come over there and take the food. So that kind of the personality. Even her siblings, the patient's siblings, brothers and sisters, when they get sicker, she always with them and taking care of them until they recovered. If they admitted in the hospital, even siblings and cousins, she went to the hospital and stayed there until they recovered. That kind of the care, that kind of the intensity of care, right? So she wants to be with them and all the day and night. The husband says, even in TV serial, when she watched the Tamil TV serial, right? If someone's sick, she get upset and feel that too. So she takes herself, and he started weeping and feeling. So when she come into the clinic the first time, right? There are 2-3 patients, they are waiting outside. So she started talking. Yes, I observed her. She started talking with them about their problem and what kind of problem you have, why you came over here. She talks like that and very nicely, and she inquired about that very curiosity. Right? And also when she came first time, that's also I observed. When she came first time, right, in my clinic, she bought some food, some snacks for me. Even I didn't know about her, right? She said, doctor is very good. It's naturally prepared by me. It's very natural food, very healthy food. So like that, just conversation is going on. Now I think most of you know what remedy. Anyone? what remedies she belongs to. So I will do the screen share. I think a very respectable person, right? Mother Teresa. So she is the one, the queen of compassionate care. So whenever you think about this remedy, you have to think about the great soul, the Mother Teresa, divine love in human form. So I always respect the Mother Teresa. So whenever I study this, the drug, I always remember her, right? That is a Cocculus indicus. Right. This is a very interesting remedy, and we are going to discuss about that. Right. So I got some text from Dr. Rajan Shankaran, Soul of Remedy. Cocculus has been used from ancient time as a poison for stupefying fish and making them easy to catch. Right. So that's the practice was not now, it was just in the ancient time. The cocculus has its active poisonous principles of, right, that's called picrotoxin. That's a very poisonous, the ingredient which the cocculus has. Even still now extensively used in Great Britain, in England, for the purpose of adulterating malt liquor, it's being supposed to greatly to increase their intoxication, right, property, and also prevent the secondary fermentations. So even still they are using in various purpose. The cocculus was first introduced into the materia medica and used as a remedy in the treatment of disease by Hahnemann for various conditions. So mainly this remedy this cocculus remedy we known as a vertigo remedy, nausea and vomiting. But today we are going to study the other aspect of the cocculus. Not only the nausea, vomiting, or smell of sight of food, these are all what we know already. But today I'm going to discuss in various dimension. You are going to study that, right? Now we'll come to the right cocculus. The vertigo. The cocculus produces a well-marked vertigo remedy described as like drunkenness. It occurs when sitting up in the bed, right? When getting up from the bed, the vertigo, the symptom starts and it's aggravate. It's always with nausea and vomiting. The cocculus plant. Cocculus is a plant remedy belonging to the psychotic miasm. It's similar to the pulsatilla, similar to that pulsatilla and ignatia. The situation of cocculus is of an unmarried, childless woman, right? She takes care of, or she takes on the role of caring and looking after the people, right? Suppressing her own feeling and desires. So there you can see whenever you study, whenever you understand this one, the most of the nun, the Catholic nuns and Christian nuns, those who are doing the service, right? So we have to respect them and we remember always. The cocculus person are very sensitive to the suffering of others. So they are very sensitive. Whenever the people sick, whenever the people they suffered in the society. So that's why the Mother Teresa, right? She came out from the the convent. She came out from the congregations and he started this kind of service. Right? Anxiety for others always. Because of that, taking care of the people, taking care of sick people, taking care of the poor people. That's why loss of sleep, right? Because the whole night they don't worry about themselves. They take care of the people. Loss of sleep produce oversensitivity, right, to the nerve system. You know this remedy, actually it's a cerebrospinal remedy, right? It acts on the cerebrospinal system. Very interesting remedy, right? And the patients oversensitive to noise and riding a carriage, and these are all the common things what you know, right? The dullness, sense of imbalance as a result of the patient wants to lie down with their eye closed. And here one of the important rubric, sadness as if from insult. And also the other rubric in Cochlus, taciturn. So we are going to discuss about the taciturn. What is taciturn? It is very, very important symptoms in Cochlus. There are the other one or two remedy also has the same symptoms. What is this? Taciturn. Uncommunicative in speech. They put in everything. Why the taciturn comes? From where it comes? Because of the insult and humility, suppression of anger. So that's why the patient, they put everything in inside and keep silent. The second patients that I'm going to see later, or maybe in the next class, that this patient is very interesting case. Even I can show you the picture of the patient. Did you see the video? Anyone?
Yes, please open.
Okay. So this is the case of Parkinson's. Recently, I started treating this case, right? Very interesting case. I prescribed this Parkinson patient's Cochlus. Now you can see. Okay, we'll come later. This one. Okay. Now, there are certain things I have to explain you about the Cochlus. Cochlus is very similar to Staphylococcus, as I told you, Pulsatilla, Ignatia, Nux vomica. The main theme of the Cochlus is anxiety for others, taking care of the others, the compassionate, right, with others' care, taking care of others. They feel they have to sacrifice their life for others through the love, care, and compassion. So that's why I took Mother Teresa as an example. And also Cochlus, one of the best remedy for this symptom, always we studied in the Materia Medica. Time passes too quickly. What it means? When I go into the Materia Medica literature, I came to know that's a different ideology about the time passes too quickly. What it means? There's the remedy, time passes too slowly. That's also we have some remedy like argentum nitricum and cannabis indica. But the cocculus, time passes too quickly. What it means? How? What we are going to understand from this the sentence or this rubric, right? The patient statement usually like this. In my life, they started talking like that. In my life, I have to do a lot of things, but I don't have enough time. So in such a way, they started the conversation, right? With in the family, as well as when they come to you as a patient. So they started talking like that. I could not do anything. I could not do anything in my life. I have so much talent, but no time to expose it, no time to do it, all these things, because time is moving fast. So in the same way of conversation, they explain in the rubric. I think I'm wasting time. So he started telling like that. I feel too tired, dullness because of my health issues. I can't able to concentrate in my family care. I'm not taking that much of care. That's why I'm worrying. It's killing my time. Time passes like a rocket. So these kind of the word they use always. And also the cockless patient always negative thoughts. They have negative thoughts. My other friends, they are doing good. Now here they compare with others. My other friends and other people, they are doing good. They have done so much, but I have done nothing. So in such a way, they express their feeling. That is a cockless. And the cockless anger, one of the best remedy for anger. How they express the anger? There are many remedies, right? In Naxomica, then the argentum the argentum nitricum, and the other remedies, lacases, chamamulla. Those remedies are useful for, right? Stabsacria, one of the best remedy, right, for anger. I'll tell you how to differentiate all these things. The cockless anger always when not listening his ideology, not listening is properly. When she contradict with someone, when the something is not going to her wish, then she get angry. The anger starts. But in case of Stabsacria, that's a different kind of symptoms. Stabsacria anger, usually that's a suppression of anger. The anger comes after insult and humiliations. So whenever the insult and humiliations, so all the anger comes and she's suppressed. And also anger comes in arises in Stabsacria when very sensitive, right? Challenges of dignity and honor. Very sensitive to what the others saying about him or her. So it causing the anger. Anger after suppression of all emotions. That is Stabsacria. Ailments from suppressed anger. Right? Everyone knows Stabsacria. So what about the Naxomica here? So we have to compare with the Naxomica too. Naxomica is always irritable, very impatient, right? And malicious. What is malicious? hurt others, like drunkardness. When the people, they take alcohol and they started talking all sort of nonsense, then they hurt others. Sudden outburst. Naxomika anger is sudden outburst and started all shouting and all these things. And also jealous. In Naxomika, we have jealous. If anything bother him, right, immediately he just outburst. So that's the difference between the cocculus, Naxomika, and Staphysagria. In cocculus, they are very genuine service. They are doing very genuine genuine service. That's why in Materia Medica, they said nursing, right? But most of us, we think that nursing, those who are working in the hospital, no. Hanneman and Kent, they doesn't mention about that nurse, the professional nurse. No, that's a care, right? That's a very, very, very passionate care. Most of the time, the students, they confuse about there's a cocculus is a nurse's remedy. No, that is not the meaning. That's a different meaning, right? So what happened? It's a habit. It's a habit. Taking care of that must be the personality, right? Who care for others, who thinks about others' care, right? And about taking care even during, if they are sick, the caretaker, if she or her sick, they don't bother about their illness, but they take care of others, right? You see a lot of people, right? The cocculus person will help others even in any circumstances, any situations. Immediately they go and attend and take care of them, right? So that is the real caregiving character of cocculus. Don't think it's a remedy for vomiting. Again, I'm telling that vomiting, where they go, no. Whenever the patient comes, this kind of nature, that may be a headache, that may be a ulcer, that may be a peptic ulcer, that may be a low back pain, whatever. But the patient come with this sort of the symptoms or the personality, just you have to think of cocculus. Any kind of ailments. And here the anxiety and care, that's also very important, right? But what is the difference between anxiety and care? Anxiety, just thinking and feeling. Many remedies in homeopathy, in Materia Medica, we have anxiety, right? Anxiety, the symptoms. That is just simply thinking, right? And feeling. But here in the cocculus, that is a real help. They actively they do. Very compassionate. I am repeatedly again and again I am telling, it is a sacrifice. Full-hearted, helping tendency, right? And the other symptoms in Materia Medica, cocculus Materia Medica, they mention dullness. What is dullness? There are physical as well as the mental dullness. The mentally, how the patient expresses dullness. Dullness means not like this dullness. No. That's a different meaning. No answer. First time. The cocculus patients, they are very response, right? Delayed response. When they answer, when you ask the questions, right? They never answer immediately. The delayed response. Repeatedly, they asking, right? Then only, if you had to ask 2-3 times, then only they answer. If you ask the third questions, they may answer the first questions. So that kind of dullness, right? That is called actually dullness. Usually, the answer for the previous questions. And the other dullness, other symptoms also is there. The patient used to tell the word actually. So whoever used the word actually, doctor, I know that. Actually, doctor, you know, many of us, fortunately or unfortunately, we use this word. But this particularly in calculus, they use the word actually. Actually, I know, but I forget, sir. I forget, doctor. I forget to bring that report. So, right? But I know the answer actually, but I don't know why I forget that one. That is that kind of dullness. And also repetitions, right? Repetition is there. Again and again they will tell. Again and again, when you ask, right, then only they will answer you. And other important symptom, the sadness as if from insult. Cockless, very, because the second case, the Parkinson case, I will explain maybe later on in the next class. Very, very interesting story he has, right? The insult, offended, right? See, he suppressed everything. What happened to him? It's very crucial, right, things. I'll tell later maybe in the next class. So the sadness, usually very sensitive, very silent, no argument, no fighting. But the other remedy in Chamamulla and Naxomica and the Staphysagria, the fighting will be there. But in Cocculus, very silent, sad feeling, no argument, no fighting. They put everything inside. So silent, right? Keep silent. But that patients also, the second patient, the Parkinson patients, really, right? He keeps everything silent. Slowly, after one year or 2 years, the symptoms develop. The Cocculus patient came to you for the treatment. This is another interesting thing what many of our pioneers, they observe. I also observe these symptoms. The Cocculus patient, they came to you for the treatment, but you prescribe, unfortunately or fortunately or knowingly or unknowingly, this some other remedy, right? While taking a history, right, you just imagine some other remedy and you prescribe the different remedy for this patient, right? But he is not getting well. The patient is not getting well even after a few months. You know what the patient says? They will come to you. They will they will attach with you, right? The patient will tell, doctor, you are a good doctor. I know. Maybe it's due to my mistake. I'm not taking properly, right? I'm not taking your advice properly. I'm not following your instruction, right? So the patient, they blame themselves. They don't blame doctor always, right? They don't blame others. That's why that is a very, very characteristic key point of the Cocculus. You must understand that. They always polite. They always polite and they blame on themselves, right? You are a good doctor. You did a good job, doctor. But unfortunately, so like that they started talking, right? You know what is the rubric? This one, reverence. There's a rubric called reverence. That's a remedy, Cocculus, right? They are very polite, and also these Cocculus patient, they respect the others. They respect the seniors. They respect the old people. even in the community, at home and outside, they give respect. But the problem is immediately, right? Sometime the initial picture of cocculus is just like Naxomica. Suddenly they burst out sometime, and finally they understand. That is the cocculus nature, right? They don't offend others. If it has happened, suppose if they raised voice, right, and hurt others, after a few hours later, they called them and they came to them and they apologized. They apologized. They are sorry all the time. So that is the nature of the cocculus. But it's not in Staphy and Naxomica, right? In sometimes the first time they get upset and they raise the voice, but later they become silent and realize the things, and right, that is very interesting. And this the cocculus mainly it's a cerebrospinal remedy, as I told you. Now we'll come to the okay. So what are the rubrics mainly? See, rubric: sadness as if from insult, and anxiety for others, help, anxiety for others, anxiety, right, from loss of sleep, because they compassionately, they sacrifice their life for others. So like that, there are a lot of rubrics, right, single remedy rubric you can, right, sensitive to rudeness, and grief, ailments from grief. The other remedies, pulsatilla, the ignatia, causticum, you can differentiate the grief, right? And time passes too quickly. Delusion headless he is. That's a, right, in always I told you, right? This book, I think always you remember, sensation of, right, sensation as if it's a robot. Delusion he is, headless he is. Anxiety from rudeness of others, anxiety about health, anxiety of loss of sleep, sensitive to rudeness, ailments, anxiety from grief, anger, insult, vexation, so these kind of things. So I told you in the before, not exactly the complaint that come from on the professional nurse. That's a different, right? So don't think that. And the other here, the paralytic weakness in the limb, numbness, jerking muscles, twisting, right? Loss of sensation, loss of muscle power, muscular weakness in all the limbs. Even in causticum and lycopodium, the plumbum, they are all the similar drugs. But here, very characteristic symptoms, sensation of hollowness, emptiness in the affected part, mainly in the affected part and also in the head. So in the sensation acid book, right, in general, you can see emptiness, hollowness in various cavity of the body, especially chest, and also in especially the affected part too. That's cocculus. The remedies like Parkinson's, right, and other, the chorea, Huntington chorea, that is a right shaking, shivering, the tremor. So this kind of things you can think of the cocculus. Here the toxicity, I already explained. This is a picrotoxin. It's a powerful, very powerful central nerve system stimulant, right? The another important things, this is the things I want to show you, right? Now, the Western system of medicine, allopathic system of medicine, now they are copying. Even the previous, my session, I explain all these things in the topic of precision medicine, right? I think all of you remember. Now they started copying our homeopathic drugs from the literature or Materia Medica. Then they started doing research on that. Then they prescribe as a Western medicine. But this is the one of the remedy recently they stolen from homeopathy, right? The picrotoxin, that is the allopathic medicine. You know, for what they use? You can see, right? The GABA system in the vestibular nucleus, cochlea. You know, vestibular in the brain, and also vestibular cochlear nerve, one of the cranial nerve, and the vestibular in the ear. So that's why the vertigo. You know now the pathology of vertigo, from where it starts, right? It's a very interesting thing. They got this ideology from homeopathy. Now they started treating with a vertigo with this remedy, right? See, a lot of things we have to be careful. The senior homeopaths, those who are here, right? The picrotoxin, right? See, now they use the GABA. You know GABA? What is GABA? This is GABA, right? Gamma amino butyric acid. This is the one of the best neurotransmitter in the nervous system, right? It's a chemical messenger. So whenever the imbalance in the GABA, the most of the problem starts. Like dopamine. Whenever dopamine deficiency, you know, the Parkinson's and other symptoms. So like that, the GABA is a very interesting neurotransmitter in the synapse, in the nervous system. So when it's depletion, when it's deficient, or when it's imbalance, a lot of cerebrospinal problem starts, like amyotrophic lateral sclerosis and the other sclerosis diseases, right? Motor neuron diseases. The picrotoxin, that is the ingredient of the cocculus, it helps. In such a way, now they started stolen our medicine. Thief. They are the thief people, right? They stolen our medicine doing research and all these things. Now they are doing research. Picrotoxin, most often used in the research tool, they use as an injection, right? In various purpose. And also the picrotoxin, the Cocculus indicus, performance enhancer. Those days, you know, the sports people and the horse riding, right? For the competition, they inject this remedy into the horse, and they become very active and running fast, you know, that kind of things. And they also use as an antidote for the various the drugs like cannabis, barbiturate drugs, opiate drugs. So the picrotoxin, cocculus, they use as an antidote. And they use as a pesticide too. Now, this is the recent things. 2023, you can see here. Last year, our cocculus remedy, they stolen, and now they are doing the research on Alzheimer's. See, everything's there in their website, not our website. That's why I'm telling, right? They are doing research for our cocculus picrotoxin. They took an ingredient, and now they are doing the research. Alzheimer's. Okay.
Hello, sir. Our time is about to finish.
Okay, that's okay. So I'm going to stop at this. Any questions? Yeah, we have another 5 minutes. Any
Yes.
questions?
Yes, it's really a very good session. Everybody thought that the medicine was phosphorus. I was also thinking about that, but you came up with some different remedy that is cocculus. Once Dr. Padma Priya has presented a session on this cocculus that was also a different variety, and both your session was really exemplary, brilliant one. And congratulations! And those who want to participate in the discussion may please raise your hand so that we can have a short discussion for some 3 to 5 minutes. So it's up to Dr. Manoj to begin with the session.
Thank you, Dr. Tanesh. As always, you're always presenting strange, rare, peculiar topics. That's the most important thing. And then again, you mentioned about this co-oculus. I think a question, it is the opposite of this co-oculus condition, in your opinion.
What is that?
Always caring for others,
Ah,
which is the medicine having an just opposite condition. No, don't care others.
yeah, that's also initially. But when the patient come as a real picture comes out, they'll take care. That's a real picture. Like I told you, the Mother Teresa. Just you think of Mother Teresa.
Just the opposite care. I think the capsicum maybe, because in Ken's material it says it is a devilishness, he says. It is a capsicum. It may be. My suggestion, I'm not sure about that. Then what is the most interesting thing is your illustrations of different conditions, the anger, the nursing, all these things. You illustrate beautifully. Then again, I think you should have might have got a thorough base on this organ of medicine. Without studying organ properly, you can't teach material in this way. That's a good lesson for them, all material teachers, I think. Anyway, nice presentation. There is no doubt about the potential. Thank you.
And not only that, he explained beautifully what is taciturn, as well as the time runs too shortly, and sometimes what's the basic difference between time goes so quickly also.
Yeah,
So yes, people may think that the time is simply going because the patient is in a hurry and he has to do a lot of work, and that's why the time is not enough for him to complete all the work. That's the reason why he is finding short of time, and that's you beautifully narrated the same. So I invite Dr. Rambari sir for your comments also.
And any questions? Can ask.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Paul Joseph sir. Very nice presentation, excellent session. Cockless remedy, very good describe. Elements from combination of paralysis, anxiety, loss of sleep, and anger, grief, etc. Very, very thanks, Dr.
Thank you.
Joseph sir.
Thank you. Thank you.
Now I invite Dr. Maria Salcedo from Bolivia to make her comments.
Thank you very much, Dr. Ganeshi. Thank you, Dr. Paul. Amazing presentation, excellent. Discovering new remedies from me, from great teachers as you, is simply a blessing. Thanks to all IFPH team, because you always give us training for great teachers every day. When I was listening to Cocculus, I find certain similarity in the compassion of carcinosinum. Does Cocculus have exhaustion from caring from the sick? And how could I differentiate Cocculus from carcinosinum and causticum? Can you please give me some advices? Thank you very much. It was an amazing session.
Yeah.
Thank you. Thank you.
Yes, doctor, there was a comment that it is something like carcinosin. And what's your opinion on that?
Yeah, carcinosin usually, I'll tell you from the care of carcinosins. Actually, it's there's a fastidiousness, sensitive to reprimand, and they offended easily. The cocculus, they offended easily too, but they keep silent. They keep silent and everything, right? They doesn't show immediately. They keep everything silent and silent inside. That is a one difference you can differentiate. And ailments from anticipation. But they are in cocculus, that's not the prominent symptom, ailments from anticipation. Here, the careness and the compassion with anticipation, right? And at the same time, there's a sympathy. In carcinosin, you can see a lot of sympathy, but in cocculus, they are not doing because of sympathy, because of compassionate they are doing, because of sacrifice. So you have to differentiate with the sacrifice, compassionate, and sympathy.
Okay, sir. Thank you very much.
So this kind of.
As we have only short, now I invite Redmi. That will say, please introduce yourself and you can say a vote of thanks to the session also. Please unmute, sir. Please unmute yourself. Please unmute. Redmi, that will see. Please introduce. Please, everyone. There's a request from us. There are some people trying to sabotage our program, so please join with your name so that we can identify you. What you are. Please unmute yourself. Redmi T3. If you want to say no. It's not responding. So, Dr. Manoj, you can say vote of thanks to the session.
Yes. As always, there is no doubt about the potential of this physician from Canada. He's always doing wonders. And we hope we'll come again with some wonderful presentations, some mesmerizing presentation, I must say. So on behalf of IFPH, I'm expressing sincere thanks to all those participated session, Dr. Paul Joseph and Dr. Sanesh and all those things. Persons, thank you once again.
Thank you all.
Tomorrow we will have a session from Dr. Manish Singh Azad, and the subject is schizoid personality disorder. That's a different subject tomorrow. He's always coming up with the personality disorders, and that will be the discussion tomorrow at 8:30 onwards. Hope all of you will be with us, and thank you, Dr. Paul Joseph, and those who joined in the session from different parts of the world. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.